Hi everyone, this is Choosing a Different Future with Siris. I am Siris, and I am so excited today to introduce to you one of my dear friends, Dr. Moshe Dekel. Dr. Dekel, as I'm going to call him, at least for right now, is a holistic board certified OBGYN in both Long Island in the tri-state area. He specializes in breast thermography, bioidentical hormone replacement, autism, ADD and ADHD, emotional stress like anxiety and insomnia, just to name a few, nutrition and all of the holistic health needs, anything you could possibly imagine. This man has something to say about it. He is DIN, which is Defeat Autism Now. He's a DIN certified practitioner, and he works with bioenergetic medicine, which I will absolutely ask him to describe in more detail. He happened to be born in Tel Aviv, Israel, and has this amazing life story that I always keep, every time we talk, I hear another piece and I'm like, you really did that? You really chose that? Like, what? Okay, back up. Let's talk a little bit more about that. He started his life in Israel and it led him to Italy, then to New York and to South Carolina. And he's traveling all over the world, has multiple global businesses and continues to add more and more businesses to his repertoire. The man won't stop, and I freaking love it. It just, he's the Energizer Bunny of holistic medicine and of really inviting not only his patients, but anyone that interacts with him to really consider different and more possibilities for their lives, for their bodies. And so welcome, welcome Dr. Dekel to the Choosing a Different Future show. Thank you for agreeing to be on here amidst your busy schedule. Really appreciate it.
Thank you so much for inviting me. I think we're gonna have a great time. You know, is you're talking about me, I kind of think, is she talking about me? Is it me or somebody else? It's like, really? You know, when you live your life and you just make your choices and you arrive at a certain place and you just look back and you say, well, how did I do it? As we say, it's one choice at a time, one decision at a time.
Well, and I think that, you know, you get that, and we've talked about that a bit over our many conversations, and I will have many more. A lot of people don't really get that their choices right now are creating their current lives, their current bodies, and their future lives and future bodies. And you're just so humble sometimes. I'm constantly pointing out to you, like, dude, do you get how different you are? Do you get that, like, not everyone would have just chosen that as easily or been willing to go there and go to these unknown places and these different adventures. And I suspect it wasn't as easy for you in that moment, but you were able to risk it on yourself and be brave and courageous. And what actually helped you going let's start with from Israel to Italy? What was some of those choices that led you to go from one country to the other?
Yeah. Well, again, thank you for describing in such beautiful terms and adjectives. But I want to make it clear to everybody that it may look like it's extraordinary, and maybe it is in some respects, but I'm telling you right now, looking backwards, I think anybody can do it, and if they want to do it. And I'm not saying that every decision I made in my life is the right one, and I've made some pretty bad ones too. But to answer your question, after I finished my military in Israel, I worked during the day with my father. Used to have a small diamond polishing factory. I do it during the morning, during the day, and during the night, I actually enrolled in law school. And it's kind of interesting because it wasn't really my idea. It was more my father's idea, you know. And it made sense to me at the time because I said, well, business and law go together. I said, you know, I'll kind of get into my father's business and plus be attorney on top of that. It sounded logical to a 21-year-old at the time.
Right.
Well, it took me 2 years to realize that I hated law. I just could not stomach it. I finished half the curriculum
Mm-hmm.
while working, and I'm just not happy. I was just not happy. So my mother always told me, you know, you really should become a doctor. Like every Jewish mother wants her son to be a doctor. If you don't know, now you know it. And I said, Mom, you know, I, I really cannot be a physician because I cannot stand the sight of blood.
Which blows my mind right now, because I've seen you give people injections and IVs and all this stuff. And, you know, seeing that now, you wouldn't think that there was a time ever that you were squeamish about blood.
That's correct. That's correct. And it's kind of interesting because, and my mother was smart enough not to kind of push it on me. She just made it, you know, once in a while, a little drip, a little drop, a little. And my mom
Well played, mother. Well played.
Yeah, she was a smart woman, smart woman. Anyway, she was helping us at the factory, okay? And one day, she actually stepped on a piece of glass. Now, when you deal with diamonds, you actually use a magnifying glass. It's called the loop to actually look at the diamonds and, you know, assess the work and the purity, etc. So what I did was I took this little magnifying glass and I looked at the bottom of the sole, the foot, identified where this piece of glass was. Then I took a little pickup, which is actually used to sort diamonds, okay? And I was able to take it out. So my mom looks at me, she says, do you see what a good doctor you can be? And it was the right moment, the right time, the right mindset. I was unhappy with what I was doing.
Yeah.
And I said, you know what? Mom is right after all.
I almost wonder, given that, like what you told me about your mom, if like I wouldn't be outside the realm of possibility for her to like have intentionally injured her foot to create like, you know, I'm not saying she did for sure, but I'm like, if you had told me that, I wouldn't have been surprised.
Yeah. When I meet her again, I'm going to ask her, because I'm telling you that you're not far from the truth. I don't think so. But and she would have. Oh, there's no question in my mind she would have done it. Oh, absolutely.
And either way, it worked, right? And it led to this amazing adventure.
And, you know, we would do it for our kids any day, you know. Anyway, so two of my friends after the military, okay, went directly to Italy to medical school.
And here's the thing, not everyone on here is maybe knows this, but in Israel, it's mandatory for you to participate in the military. So everybody has this time in the military where they it's like 2 to 3 years, I believe, right?
At the time, it was 2.5 years.
Yeah.
Everybody goes, yeah.
Yeah, it's just one of those things that is just an accepted practice, and then you can choose to continue to be in the military or leave afterwards.
It's a rite of passage in a way, and usually most young men and women, because women are also drafted unless they're married or they have a child.
Mm-hmm,
so, I waited for the summer vacation because my two friends were in Italy. They came for summer vacation to Israel. So I met with them. I said, okay, guys, how is it? Oh, it's fantastic. I said, you're in Italy. You're studying in what language? Italian. I said, did you know Italian before you went? I said, no. I said, so how you do it? Don't worry, Italian is easy. And I said to myself, well, I knew them through high school, etc. So I knew if they can do it, I can do it. So I didn't question it anymore.
Yeah.
So I said, you know what? I'm going to go for it. But I didn't want to go by myself. So I recruited my cousin. My cousin also finished the military. And I said, his name was Jacob. I said, Jacob, what are you going to do after the military? He says, well, I'm going to study biology. I said, in university. Okay, we don't have college. We have high school, military, university, European. I said, great. So what are you going to do with biology major? He says, well, I'm going to probably teach. But I said, well, is that enough? He says, no, I probably have to get a PhD. I said, or at least a master's. I said, well, how many years is it going to take? He said, about 6, 7 years. I said, great. And how much money are you going to make? He said, I really don't know, but I don't think it's going to be too much. I said, well, I'll tell you what. How about we go to Italy, invest 6 years, become doctors? Well, he said yes. And here we went. We went to Italy, and it was probably one of the best, part of my life. I mean, it was an absolutely amazing experience.
So let's get this straight. Back up a little bit.
Yeah.
We're just going to slide through this. So you didn't speak Italian.
Yes, I do.
Before going to med school.
No. I spoke no Italian whatsoever.
Before going to med school, because it wasn't just a university, it was med school.
Yes, because
Italian,
again, in Europe,
in Italy.
You have a high school, university, or it's medical school together. So in medical school in Italy or Europe, it's 6 years instead of 4 years. So that's the difference. So the basic sciences are in the first 2 years, et cetera. So, but that's what we do in college here. So that's the difference.
Yeah. So, wow. Okay, let me just say, wow. And so then you're in med school. So what did you do, and how did you navigate the new language while also learning this new content that isn't like necessarily like easy peasy, oh, I can do in my sleep content? Like this is like life or death information that you really need to know inside and out.
Yeah.
What tools did you use? What resources did you use?
Well, we went to Italy about 2-3 months before school started, and we enrolled in a university course for language. So we had really a language course that we took. But I can tell you one thing: the best Italian lesson that we got on a regular basis was every evening we went to the movies that spoke Italian.
Ah.
Because they don't have subtitles.
In the theater, yeah.
And guess what? This was the time that Clint Eastwood came to the scene.
Oh, and you love yourself some Clint Eastwood.
We saw so many westerns. Let me tell you something. By the time we got to the first class, we understood the language. It was
That's amazing.
Not only that, but in Italy, at least at the time, when we talk about 1967, 68 actually, very few Italians spoke English. So if you wanted to communicate with Italians, which you had to speak the language.
There was immersion completely, sink or swim. Like you got your fully every multi-sensory experience in there. You're eating, drinking Italian.
They're very, very gentle. They're very forgiving, and when they see somebody who came to the country, tourists or whatever, trying to speak their language, they'll try everything to just understand them, explain to them. They'll go out of the way to show them. I mean,
they appreciated the effort.
Italy is really my second home. Actually, one of my 3 homes: Israel, Italy, and the U.S.
Yeah, that's really beautiful. So then, what led you to choose to go to the U.S. and not go back to Israel after finishing medical school?
Okay. I decided that I wanted to have a leg up on the other graduates. I wanted to come from not just medical school in Italy, but I wanted to come from a U.S. trained physician. In other words, I wanted to do my internship and my residency here and come to Israel ready made. I didn't know what specialty I'm going to take, but I wanted to actually have education in the U.S. That was my goal. And, other things happened, and I happened to stay. But remember my first initial statement about blood?
Yeah.
Can't stand it. So here I am in my internship and residency. I decided to go into OBGYN, which is pretty bloody.
A little bit. In addition to a bunch of other fluids. There's a couple other fluids involved too.
So actually, looking at that, it was my feeling that I couldn't stand it. It's again, it was subconscious fear, I guess, and rationalizing in a way that I can't do it, even though when I decided to do it, it was done.
And here's the thing, is it like that demand of yourself? Like I see you do that even now all the time when you're like, you see yourself kind of hitting this like resistance, almost like, oh, this is really uncomfortable. And then you make the demand of yourself to push through it, to like go to through the other side of that discomfort. And it freaking impresses me all the time. For you to not kind of like, I guess the phrase is like rest on your laurels and just keep and be complacent about your life. Like you're still actively choosing to create your life every day. And some people that are your age would give up on their lives right now. They're like, they retire, they don't have to, they kind of are just resting and laying around. They're not really creating their life. They're kind of just waiting to die. And you're like, I got so much life to live. What?
You know, I used to say life starts after 50. I now change it. Life starts after 60.
Ooh.
Soon enough, I'm going to say life starts after 70. So, it's an adventure. Every day is an adventure. And, you know, each one of us has to make a choice how they want to live their life. To me, every day that is, I'm not using to promote my education, to help other people, and to make some difference in their life, if they allow me, uh, then why stick around?
Hmm. Mm-hmm. Mm-hmm. So do you get how different you are from many people in the world? As much as you're acknowledging that a lot of people could choose what you choose, do you get that most people haven't chosen it yet, or maybe might not be willing to choose what you've chosen? And it's not that they're wrong, but it just like to invite you to acknowledge that like you kind of stand out, my friend. Like
Thank you. I mean, when you say it, I realize that's the truth, but I really don't think of it daily. Oh, I'm so special. I do this
yeah.
or I do that. It's just
No, it's not a
it's
superiority thing
natural.
at all.
It's a natural way of doing it.
Yeah, you're just being you.
Yes,
So were there any
I'm
moments?
very busy being me.
Yes, I love that. I love that. So was there any moment as you were growing up or in your adventures and travels and medical school and residency that you kind of noticed like, huh, I'm actually a little different. I'm choosing something different than other people. Like,
Well, the fact that I decided to come to the States was very different. I don't recall any of my uh, schoolmates in medical school. They were Israelis, and we had a lot of Israelis there. We had about 600 Israelis there. So
okay.
we had a lot of Americans, a lot of Israelis, and other nationalities, in addition to Italians, obviously.
Mm-hmm.
I think I don't know of anybody else who decided to come to the US to get residency here and go on. So from that perspective, yeah, I think it was a little different.
Yeah. So a little birdie told me that there was a
Okay.
time when before you chose to become a holistic MD, a holistic doctor, that you were the top surgeon in Long Island or New York. Is that true?
Well, let me not claim any being top of anything. I had a very busy practice. Other colleagues of mine has described me as being a good surgeon, and I agree with that. I never lost any patient, thank God, and never had any severe complications. And I took it very seriously. Being a surgeon is not. It's not enough to do what you do right. The most dangerous part of surgery is anesthesia.
Hmm.
And I was different. I never ever let my patient go to the OR and not be there when they're being put to sleep.
So you didn't let that, like, hand that off and assume that it was done right. You were there and
I
present
was
while
there
that was.
watching what anesthesia did, and if I thought they got into trouble, I said, call for help right now.
That's
Right
amazing.
now.
And you'd think, and that's a small little thing that any doctor could really do. It just takes a few more moments.
Right. But they're not educated in that. And if they don't have the innate need to say, you know what, this is my patient, it's my responsibility. And the danger zone starts when they've been put to sleep, not when you make the first incision.
Mm. Mm-hmm. And so part of your high standards as a surgeon is from what I recall, what led you to actually consider holistic medicine. Is that correct?
Well, it's related in a different way. Uh,
Okay.
Actually, it's related to the fact that working 80 to 85 hours a week as a sole practitioner and doing surgery with my neck bent, because at that point, we did not have, the minimally invasive surgery we have now to such a degree. So we still perform regular surgery, which you actually have to look down. So actually, around 2000, about 19 years ago, my neck and back sent me a little email, "You're out of surgery." So, it was not by design because, I really don't know any doctor that one day wakes up and says, from today on, I'm going to be holistic.
Mm-hmm.
You should have a story. My story was that I couldn't perform surgery in a manner that I used to in a safely for my patient and for myself. So, I opened the door to what I like to call the real medicine. Had to re-educate myself about a lot of stuff, and still am, because it's infinite amount of information in the holistic field.
Yeah,
And
it continues to evolve. There's new research coming out all the time. And
so
one of the things that I really appreciate about you, as not only as a medical practitioner, but as a person, is you're always looking at, okay, so what else do I need to learn here? What else is possible with this? Who else can I talk to about this? Like, you're always adding people to your life and not expecting for you to have all of the answers, but you're willing to have as much as possible. Like, you're like a sponge for all this information.
I'm not here to reinvent the wheel. I'm here to practice medicine the way other physician and other knowledge is being available. Obviously, I incorporate my experience with my patients, but this is not a study. This is really, every patient is different,
Mm-hmm.
and I don't experiment.
Yeah.
Contrary to conventional medicine, who actually call it a new protocol. Okay, and sign the dotted line. We have a new protocol for you. That's experimental.
Yeah, you're kind
And
of
people
becoming
accept
a
it
guinea
because
pig.
they accept it because of fear.
Yeah.
It's very unfortunate. So I don't know if you want to go there, but
Well, actually, kind of in the sense that I would love to hear any examples that you have of, be it yourself personally or with your patients, where, given the theme of our show, that choosing a different future, where people have had all these things expected and projected at their bodies and about their lives, and you've actually seen them choose different things that maybe people were telling them, why would you do that, or that's crazy, or this is new, or this is holistic, or whatever that is, and then it actually helped them change their lives around and their bodies in dynamic ways. Do you have any examples of people where they had different diagnoses or different things showing up with their body, and you were able to guide them through, or be there, be present with them as they go on this journey that was completely unexpected?
absolutely. I mean, I'd say good 70% of my patients come to me because other doctors, conventional, has not helped them,
Mm.
or to the point that they're happy with. I mean, give you a simple example I see on a daily basis is patients with underactive thyroid and adrenal. And they come to me with medications and 6, 7, 8 medications, and still complaining of the same issues of fatigue, of hair loss, of brain fog, and constipation, and on and on and on and on. And they come to me with blood tests that show that their thyroid is absolutely pristine. Everything is exactly the way it's supposed to be. And therefore, conventional medicine is saying, hey, you're fine. Yeah, but doctor, I have a brain fog and I'm depressed. Well, I have some prescription for that. Here's another one. Here's another one. Okay, so you start taking this medication, you're getting worse and worse and worse. And when they come to me, and holistic practitioner in general, I mean, most of us know that. just talking to the person, I know that they're just not taking the right amount of medication. And just changing that and supporting the adrenal, because conventional medicine does not support the adrenal, unfortunately. They don't realize it's two together. You change people's lives. I mean, from an inability to complete the day and crashing to being miserable to having a life. And that's just a one item, thyroid and adrenal.
Yeah, and that affects and reverberates out throughout their whole life. Having that energy, having a willingness to get out of bed in the morning with ease is huge. I remember I even had that, and I was so grateful for the holistic doctor that I saw before I knew you, who tested out my adrenals and was and gave me all of this really savvy information about my life and what else was possible with it if I really just looked at that, like really started from there and then went outward from there. And within a few months, it all turned around. Actually, it was pretty immediate, the effect when I started tweaking it, but to completely get to where I wanted it to be took a couple of months. But within a week, it was already like, oh my gosh, yes.
Oh, yeah. Yeah. Usually people say to me, my patients say to me, it feels like somebody put the light on for me. And it happens within a week to 2 weeks. I tell my patient, listen, if you don't feel better in 2 weeks, I missed something. So you need to communicate with me, because I said, I don't like to miss anything. So if I don't hear from you, I know it worked.
Yeah. Yeah. And I love that, because you don't really hear that from traditional doctors. They don't like hold themselves accountable in that way. There's not this like, oh, call me within the next, week or 2 or 3 weeks. They just kind of let you kind of float out. I have met some traditional doctors that were absolutely lovely. This isn't a traditional medicine bashing fest by any means for anyone that's watching this. It's do what works for you, but also know that you are the expert of your life and your body. And if what you have been choosing so far, if it isn't working, choose something different. That's all. And then it's like, what else is possible if this stuff that you've already been trying isn't working? For many of us, we start judging ourselves when what has seemed to work for other people's bodies doesn't work for our bodies. It's like, well, if it worked for my mom, it worked for my friend, if it worked for my coworker, it should work for me too. Not necessarily. All of our bodies are different. And I was just so grateful for all the different doctors that I came across that finally were willing to listen to me and try different things and didn't make me wrong if what they were suggesting didn't work. It's like, all right, we tried that. Next, what else can we try? Because your body is different than all my other patients. It's a continuous journey, but with all of this, one of the things that I love that I see with you and your patients is that you give them a sense of hope. You make sure that you're like, okay, don't give up. Don't give in. Don't quit. Let's keep going at this, because life is worth living. And if you would like to truly live and have an exuberant life, let's do it. I got your back. And your patients are like, yes, Dr. Dekel, okay. And they get animated and excited about their lives again. It's beautiful to see.
It's kind of interesting because, and we haven't touched about it, but I would like to go into this a little bit, because 80, if not 90% of all our issues and symptoms are emotionally based. And conventional medicine doesn't deal with it for 2 reasons. Number one, they're not trained to do it. Number two, they don't have time to do it, because the average encounter in conventional medicine today is 6 minutes. Well, I take an hour with my patients because I need to know why they're here. And the first half an hour, just let them talk. I ask them questions. What's happening? Okay. And it's kind of interesting because we get into the middle of the onion, the emotions, and we start raising it up and kind of, if they're comfortable, because some people are not comfortable even, the first encounter, so I don't know this guy, and they feel vulnerable, they're not willing to do that. But I'm telling you, most of them do, because it all depends how you address it. If you give them liberty and you give them permission, you give them the license to actually tell what's going on, they will, because essentially they want to be held.
Yeah.
So it's kind of interesting, because most of my patients cry when they see me. And they say, oh, I didn't mean to cry. And I said, don't worry, all my patients cry. And I said it in such a way that it's, oh, okay, I'm not the only one who's crying here. And they come in a state of almost like catatonic shock. It's like fear. And they live with a smile. Because why? I validate them. I tell them they're not crazy. All the symptoms are explainable. Okay. And we need to address the emotions. So access consciousness is one of the things I recommend highly, as you well know.
Yeah, and that's how we met. It's so cool. It's how we met. What, a little over a year ago now? So grateful. I mean, access consciousness has changed my life on so many levels. This is not an access consciousness show, but for many of the people that are watching this, they know that I'm an access consciousness facilitator, certified facilitator. And we actually met at a access consciousness body process class. And it was your first class.
Yes, it was.
And one of many now. You've taken a bunch.
Yeah.
And you've seen and actually introduced some of your patients to the access consciousness tools. Do you want to talk about what your patients have been saying about that and how you got interested in it?
I read the book, Being You, Changing the World, and it changed my world. It opened, because again, I'm very, how would I put it? I'm interested in energetic medicine. Let's face it, everything is energetic. We may not agree with it, may not find it's true, but it is true. So in my quest for solution for my patients, I got into energetic medicine. So when it's interesting because a patient of mine told me about this here in Hilton Head. In the beginning, I said, I asked her to death. And finally I said, let me check it out. So she was talking to me for a year before it actually went to the first session.
Yeah.
From then on, it was like, wow, this is a way that most of us, if not all of us, need to at least explore. I mean, I saw so many books of Dan Hare, you cannot believe, because I tell my patients, you need to read it. It gives you tools. It's not theory. And if you're willing to open yourself to the modality, it will help you change your life. Making different choices. Our reality is set by our choices. If we don't like our reality, let's make a different choice.
Yeah.
So I use it heavily, and I can tell you that all my patients who are doing it are getting help.
All the patients that are using the access consciousness tools?
That's correct.
So it's a nice supplement. Does it complement your holistic practice? Well, do you notice any conflict between the two, between access consciousness and your holistic medicine practice at all?
Absolutely. It complements it to incredible degree, because accessing our issues, problems, suffering, call it whatever you want to call it, is not easy. Absolutely not easy. Not only that, but there's a terminology that a lot of us use called the blind spot. Well, the blind spot is a blind spot because you can't see it. So we need some help. We need some help with the right professionals to help us realize what is this emotional baggage or energy that we are carrying with us, and many times actually causing physical symptoms. Mm-hmm. It's our body telling us, hey, I'm going to give you a headache until you figure out what emotions you need to deal with.
Yeah.
So it's not about taking a prescription drug to get the headache and get hooked on drugs. It's about going to a holistic practitioner and say, okay, I have headaches. What's going on here?
Yeah. What's the core energies that are going on there? The core reason that this is showing up. And mm-hmm. Yeah. And a lot of it is beyond the cognitive. It's beyond the things that you can actually find in a test, but I love that you've actually been able to find ways to measure it in that progress with the people using these tools and also the holistic recommendations that you're making. And both of those together, they're moving forward really fast. I love that.
Not only that, but one of the things that is really I don't like to use the word epidemic, but I'm going to use it anyway.
Okay, you're allowed. Go for
Is,
it.
is, is lack of self-love.
Mm,
And it's kind of interesting because I asked my patient, I asked the permission, so can I ask you a strange question? And they say yes. And I say, do you love yourself? Just by their response, I know immediately yes or no. And guess what? The majority don't.
mhm,
And they'll say, I think so. Or, well, I think I'm a good person.
mm,
We come up with things that our environment, our society, our parents, our teachers taught us it's important. But in order for us to be self-loving, I'm not talking about narcissism, I'm talking about self-love, healthy self-love.
mhm.
We need to have had unconditional love from parents or caregivers. And consider the complicated lifestyle we all live in the 21st century. Many of us didn't get it, especially parents have two jobs, et cetera, trying the best we can as parents, but it's not easy. And it's never too late to learn how to be self-loving.
To learn to have that self-care and self-love, and part of that I love that you invite your patients to, and that I also do with my clients, is the acknowledgement of the gift that they be, and of what's right about them and what's right about their bodies, instead of judging themselves and their bodies, and then creating more of that dis-ease with their bodies, and more of the contraction, that solidification that is so intertwined with a lot of the diagnoses and the complications that you're guiding people through and beyond. That self-care, and that's one of the things that I've gotten from Access Consciousness classes, is it invites us to receive more of us, to actually acknowledge what's wonderful about us,
Celebrate us.
to commune with our bodies more, so we get more clear communication from our bodies of what's going to work for it and what's not. And so then these patients can come back to you with that clarity and be like, this is what I'm getting, my body's asking for and requires. Can you help me with that? When you're checking in with them about, oh, has there actually been progress made, they know how to listen to their body to know if there's even progress. Because some people, they'll tell you, I think that it's getting better, but I'm not really sure, because they have spent decades of their lives possibly not listening to their bodies. So they're not even sure if what progress and it looks like what something beyond these diagnoses that they might have had for a really long time, what would that even be like for them? I know I had that. I had chronic pain. I was chronically sick. I was, having all kinds of respiratory and autoimmune things. I didn't know who I was going to be without all of that going on.
Of course.
And a lot of people define themselves after a while by what's going on with their bodies.
Absolutely. Not only that, but Western modalities, Western society, Western philosophy, perceptions, etc., uh, tell us to, in a way, not to trust our bodies. We're not capable. Number one. Number two, we're not qualified. Number three, we need to listen to doctors about our health, about everything. And unfortunately, we're not too successful in conventional medicine in chronic issues. We're absolutely incredible with emergencies, with all the renovations of scientific innovations and machinery and diagnosis, et cetera. But, talk to a 65-year-old American on 10 prescription drugs and ask them what kind of life they have. Well, it's not going to be a good one. Not going to be a good one. So what we are doing in absolute consciousness in holistic medicine is really empowering patients, clients, to really understand that they're in charge. Mm-hmm. And in the beginning, it's like I see their reaction like them. I like to kind of play with it a little bit. I said, so who's in charge? And they look at me like, what do you mean? You're in charge. It's like, really?
Is this a trap?
Really? I said, absolutely, you're in charge. You're in charge of your decision. You're in charge of understanding what's going on. You're in charge of how much energy you're going to put into understanding what's going on. You're in charge of making any lifestyle changes. You're in charge of taking the consuming the right diet, the right amount of sleep, the right detoxification, the right supplementation. Yeah, you're in charge. I'm your advisor. You're their advisor. But it's up to them to decide are they going to implement it or not going to implement it.
You mean they
And,
have choice? What?
oh, absolutely. Oh, it's terrible. I have a choice. What do I do now? Oh my God. I can't handle it because I need a doctor with a white coat. And by the way, my white coat is behind me. I need a doctor with a white coat to tell me what I need to do. No. So we try to educate our patients, our clients, that the fact, you know what? You're in charge. You're in charge. And the way to be able to make the right decision for you is to educate yourself and finding out really what you want out of life and what you're willing to do for it. And get the knowledge and get the expertise and get the feeling and the knowledge that it's up to you. It's up to you.
Yeah. Yeah. I don't know if you know this. I know that you know that I used to be in chronic pain
Mm-hmm.
and that I used to have allergies to everything in the world, indoors, outdoors, all of it. That I had all these respiratory issues with asthma and bronchitis and sinus infections, like for about 10 to 15 years. What I don't know that if you realize, or if I've ever told you, is that I had a naturopathic doctor
Mm-hmm.
create a individualized treatment plan for me to rebuild my immune system because it wasn't low, it was buried, it was underground. Like someone could blow my way and I would get sick. So super, super grateful for holistic medicine because I did all of the other things and some of it did work a little bit, the traditional medicine. So it's not that it's not effective at all. It's just when it came to long-term results for me personally, I needed to go somewhere else. And I combined both energetic and all these different tinctures and supplements and cleanses and diet changes that ended up being, a lot of people really resist the diet changes. I was one of them. Absolutely. I did not want to remove this from my diet or that from my diet. But one of the things that my naturopathic doctor told me at the time that I'm so grateful for was, what if this is just a transitional step that you're investing in your life and your body right now so you can actually have the life and body that you would like later? And I held on to that. I double fisted it. I was like, okay, am I willing to do this for however long, for 2-3 years, recognizing that it's gonna then extend my life for multiple decades if I do this work now.
That's right.
And then, and I could do it. I was like, it's just temporary, just temporary. And I mean, this is not necessarily what would be required for everybody. So please don't be alarmed by this. But at the time, at the peak of how many things I was having to do, I had about 18 different tinctures or supplements that I was doing at the peak moment when I was truly rebuilding. And then it went down to like 5 and then like 2 and then, but that's how bad my relationship with my body was and me not willing to listen to it was back then. And there's also things now that I know that I could have done that maybe would have sped it along, that wouldn't have required 18 different supplements and tinctures. But we all do what we can, the best that we can, given the knowledge that we have available to us, given the tools we have available to us. And what if anything that we've ever chosen before wasn't wrong? It led you to now ask the question, what else is possible, and find other people and other possibilities, other avenues for you to actually get closer and closer and closer to what you know is going to work for you and your body. And that it was so wonderful for me to be like, what if this is just temporary? all of it, any of it, anything that you're going through with you and your body right now, what if it is just temporary? And then what would it take for you to actually create beyond it and have something that would be way too much fun? Because I was like, I know I can have way more fun with my body. Please just help show me what I need to do. Because I was willing to do anything. I knew that something else was possible. And I'm so glad that I persevered. I'm so glad that your patients aren't giving up and they found you so that they can actually know that there is more ease possible, less pain, more, you know, flexibility and that limberness, the movements and all of that, that like, and a lot of them, not all of them, but they're coming to you older in age, and they have they have a renewed sense of joy about their lives. I see them walking out of your office and I'm like, there's a little, you know, skip in the step. I kind of like that. Okay. Like, what is he doing in there? It's awesome.
The reason that they leave with a smile and hope and sense of finding a solution is because the tact and the way that I do medicine is so different than conventional medicine. I find that conventional medicine uses the tactics of fear and doom and gloom, and fear of actually malpractice and being sued. So if you paint all black, okay, or doom and gloom, and less happened than what you predicted will happen, you're already a hero. Think about that. So,
yeah, you're already, by being different and approaching them in a different way, they're already like, holy cow. Wow.
you know, I mean, yeah, patients come to me and it's amazing what physicians tell patients these days. Totally amazing. They intimate, by the way, that if your parents or one of your parents have had diabetes, that you're going to have it. If they had cancer, you're going to have it. It's only a question of time. It's just mind-boggling how negative and fear laden approach conventional medicine has. And I just do the opposite. I tell
So
them,
even before you were a holistic doctor, if you think back, did you ever do that and be like, wow, that was interesting that I used to say those things and now
never
you're
did.
choosing something different?
I never did.
Oh,
I
okay.
mean, that's special about me, and I'm willing to admit that.
Okay.
I never did, and clearly wear the badge of honor that I never did use the tactic of fear. Absolutely.
And
It's
given that you were an OBGYN, I love that that actually, if like for me, the implications of that are kind of huge because you're actually setting the stage for someone at birth to have their parents then be imbued with hope and not be full of fear and then pass that on to the child in utero.
oh, absolutely, absolutely. And the thing is, as you can imagine, OBGYN is probably obstetrics for sure. Is probably the most litigated specialty after neurosurgery. Okay, so as a physician, if you decide that you want to protect yourself, prepare for the worst. And if it happened, I warned you.
Mm-hmm.
Great.
Yeah.
I never use that. I never use that. And the thing is, and if if you empower your patient to make some changes and say, you know what, we're not prisoners to our genes. That's what conventional medicine is telling us. If you have the genetic makeup of history of this or history of that, whatever the case may be, you have a great chance of having it. And I'm telling you, absolutely garbage. And what you need to do is look at epigenetics. Okay, look it up. It's really the science that controls the expression of genes. And that depends on nutrition, stress, anxiety, emotions, detox, hormones, sleep, and on, just outlook on life. So just because somebody, your parents had colon cancer doesn't mean you are. But it creates a lot of work for them because anybody has a parent with colon cancer, now they have to do colonoscopy every year. That's lucrative. And I'm not blaming doctors for being greedy. No, it's just so innate to protect themselves against. It's like it's the golden standard, and
Yeah,
nobody.
it's systemic.
The same thing about mammography. And mammography hurts people, yet
Mhm.
the golden standard.
So speaking of mammography, one of your specialties is thermography.
Right.
Now, can you tell people a little bit about that? Because that's something that you could have continued to choose to do that as being as in your practice, and you chose something different with that. What is thermography?
Well, actually, thermography is the first modality that I came across after I changed to holistic medicine. Thermography is actually using infrared camera to actually assess the temperature from the breast, and actually taking one side versus the other. In other words, looking for symmetry or dissymmetry of temperatures, and really assessing the risk analysis from that. Okay, so mammography is a modality that we use compression, radiation, okay, whereas thermography is not. So compression and radiation increase the chances of getting breast cancer by 1% every time, by 1 to 2% every time we do it. And yet they recommend to do it every year or sometimes twice a year, especially if the patient has what they call dense breast.
And also risk factors like having someone in their family that has had it.
Yeah, but the problem is when you have dense breast, you don't see anything on mammography, so why do it?
Mm.
Again, malpractice. Nobody sued for doing too many mammographies. A lot of people sued that they didn't suggest it. So it's like, oh yeah, they just really, yeah. So
So if I'm
doing
getting you
mammography,
correctly, then thermography is a way for you to detect anything that might be going on in the breast tissue without the compression, that squeezing that is just so unpleasant for so many people. And then on top of that, you don't have the radiation and then all the possible side effects of the radiation.
absolutely. Not only that, so thermography looks into the future. Okay, and by the way, for a lot of doctors, most commercial doctors would say it's experimental, it's not approved. Well, if you check out the FDA approved it back in 1982 as an adjunct. In other words, they didn't say you can do it instead of, but I can tell you right now, if you do thermography and you do ultrasound, you're covered and you're prevented radiation, compression. Just think of it logically. If we have a cancerous tumor in the breast and we flatten it with the mammography device, what is it doing to the tumor? You don't have to be a genius. Say, well, you know what? It's spreading it. Yeah, well, why do it? Not only that, it's not just my opinion. Read the studies. Studies are Scandinavian studies, Canadian studies, not new. 15, 20 years ago, they knew this. About 15 years ago. Tens of thousands of women that were followed up with mammography that show that it really doesn't do anything good other than complicating issues. Just take the fact that we have 1.6 million biopsies a year of breast in the United States. 80% of them are negative. So again, nobody is sued because they did an unnecessary biopsy. And that's the problem.
So would you be willing to actually provide some of the links for some of those articles? And we can include that in addition to your contact information below this video for our viewers. That would be great. So this, maybe like 2 or 3 to start off with for them to like get some more information about it. Cause this is really fascinating. And I love letting people know about other things that are possible that they might not even have known about. Before I met you, I didn't know about thermography.
Well, a lot of people don't know anything about it.
Right. And it's one of those things, it's this small tweak that could really be it's very effective. It doesn't have the side effects, and then you can still get a ton of information about your body.
Absolutely. Yeah.
Awesome.
And again, I'll be happy to provide it with the link so people can go and look at, Mercola.com, for instance, is the largest holistic website in the world. I mean, read what he says about it and take notice from there.
Awesome. Awesome. So we definitely can talk more, but we're running out of time for today. So I hope you'll consider coming back on the show and we can continue our conversations about anything you want to talk about. You can find Dr. Moshe Dekel in many different ways, including his website, Dr. Dekel, DrDekel.com. He's on Facebook. And just so you know, not only is he a practicing holistic doctor in Hilton Head, South Carolina, but he's also in Long Island, New York. He's available for phone consultations. He does video consultations as well. How does it get any better than that? And one of the things that if you would like other guests like Dr. Dekel on here, go ahead and subscribe to this show. Please recommend them. You can message us at choosingadifferentfuture@gmail.com. You can visit us at choosingadifferentfuture.com to see some of our past videos, to get some more information. But go ahead and click like below this video, and go ahead and follow Dr. Dekel too. He has a YouTube channel. We're going to include that in the links below. He has a plethora of information about all these different topics. As you can tell just from this short little conversation, that he has so much knowledge about so many different things related to health and bodies and beyond. And so grateful to have you on the show for this first time, my friend. I really appreciate you taking the time. And hopefully we'll have you on here again. I think we're talking about maybe having a little like the holistic doctor corner segment to future shows. What would that create?
It'll be great. Again, thanks for inviting me. I think the topics we talked about are very important, because I believe we need to empower people. We need to empower patients. And again, maybe we can do it live so people can participate, ask questions, so we can answer them. Because if there's something on their mind, let's try to answer it. Let's try to review what they have a problem with and give them some suggestions.
Yeah, so I love that idea. So until those live calls, those live episodes, feel free to post questions to Dr. Dekel or myself below this video, and I will send it to him, and I will make sure he answers them.
Absolutely.
Until next time, thank you so much, everyone. Have a wonderful day, afternoon, and evening wherever you are in the world. Bye.